Healthy lifestyle habits are important, but making changes that last is where things get difficult. We sat down with obesity specialist and endocrinologist Dr. Minisha Sood to discuss how to make healthy lifestyle changes that last. What do you recommend for patients to achieve long-lasting results in obesity treatments?
So starting with lifestyle modification, there are studies that show us what people who are successful end up doing and what contributes to their success. So for example, they weigh themselves regularly, they track their food, they attend their follow-up visits with their weight management specialist or their internist or endocrinologist, whoever's managing their weight progress. They have a support network, they may do exercise on a regular basis, and it's at an increased level than just your average person who doesn't have to deal with maintaining weight loss.
Can you go more into detail, like who actually encompasses the healthcare team when you're trying to treat obesity?
So that's going to vary from patient to patient and their access to care and their socioeconomic status and lots of things like that. A dream team would include an obesity specialist like an endocrinologist or an internal medicine specialist who's well-versed in obesity treatment and the chronicity of it and what leads to success. A patient, their support system, maybe a nutritionist, a trainer perhaps, maybe even a therapist in some cases if there are behavioral issues that need to be continually addressed. It really takes a lot of support to create an environment around oneself that sets someone up for success.